Okay, so good evening, everyone. Thank you for making comments there. Welcome to our Facebook Live tonight. My name is Mr. Alan Matus, and I'm a nurse educator for 25 years, helping students pass the Nclex or the licensure examination for nursing in the US. And also, I'm a full-time nursing faculty in Los Angeles in a nursing program, and also I'm an author of a book that I published in Amazon. Okay, so hopefully everybody can hear me very well. Okay, so my book in Amazon is titled Simple, Fast, and Easy NCLEX Review Book, and it has a 5-star rating. I know that some of you have a copy of my book, so I would appreciate it if you can give comments in the chat box on how the book is helping you right now, or if you like my book, everyone. Okay, so for tonight, we have interesting questions. So our topic for tonight starts with letter P, and you will find out later on why. So the same thing for tonight, prioritization, delegation questions. We'll be having 4 patients, and then also some questions on drug, and then also delegation questions. But of course, the main highlight of our discussion for tonight is me discussing and expounding on the topic so that you will understand more about the disease condition. Okay, and then without further ado, before anything else, also, I would like to give a shout out to the people who came in early tonight. So we have Garima Srivastav, Ramraj, Snaiden Conte, Garima, Uche, Odi Nife, Chantal, Floribel, Rosaline, Cherestal, Caroline Robert, Mon Carolino, Alfred Koji Garcia. I know this person. And then we also have Cheryl Antipolo. We have Garima, Princess Porcel, Joe Balski. She's our student right now in the online academy, and then we have a lot more people. So, and that's it. So, without further ado, let's proceed and go to our program. So, our program for tonight will be having a testimonial first. So, let's have this testimonial. So, our testimonial is from student Jean Killeen. So, she's our student for the self study program. So, she sent me an email. She said, "Good afternoon, sir. I just want to deliver a good news. I finally passed my NCLEX exam, so I would like to express my gratitude because the program that you provided has helped through my journey in passing this exam. It was very helpful, and I'm really glad that I discovered Matus Nursing Review. Again, thank you so much, and I hope, I don't know what's the next one, but it was cut off." Okay. But again, we have a shout out here. It says, "Nice book and cover all NCLEX topic. Thank you, Pratixa, for making a comment about my book." Okay, and then another one also. I would like to share this with everyone. This happened actually a few months ago. I was given an award by our school where I work, and it's a Preceptor Award. So I was surprised, but it's a good award that was given to me as a preceptor to some of our teachers, and of course, mentorship to our fellow faculty, of course. So yep, so congratulate me, everybody. And then also, okay, of course, for tonight, you have a chance to win a free 90-day online access NCLEX review. Okay, we had a winner last week, and she's already enrolled in the program. And hopefully, Marianne can give us some comments how she's finding the program right now. So, give us a comment, guys. All right. And don't forget, everybody, please click share or subscribe if you're watching on YouTube. It will benefit a lot of nursing students. The purpose of the program is, of course, to provide you information about the topic that we're discussing tonight. But at the same time, the purpose of the program is to change the way you think. And again, I encourage you to watch all of our sessions, in YouTube or Facebook, all of the Facebook live sessions so that you can practice your test taking skills. Okay. So everybody, are you ready for our first question for tonight? Everyone, are you ready? Can you please say a big yes if you're all ready, guys? Okay. What's the name of the book, please? It's the Simple, Fast, and Easy Nclex Review book. We can share the link in the chat box or in the comment section. Okay. All right. So everybody's ready. Let's have our first question for tonight, everyone. Okay. So our first question is a prioritization question, and we have 4 patients. Okay. And it's my birthday next week. So greet me happy birthday, everyone. I'm 1 year older. I'm 23 years old. Okay. All right. So let's have our first question, everybody. So the nurse performs morning rounds in a medical surgical unit. Which client requires immediate attention? A. The 44-year-old client with duodenal ulcer who reports abdominal pain and hemoptysis. B. The 60-year-old client with uremia who complains of dry, itchy skin and ammonia-like breath odor. C. The 55-year-old client who develops severe chills, body aches, and fatigue due to flu infection. Or letter D. The 70-year-old client with hepatitis A who has jaundice, clay-colored stool, and dark yellow urine. Okay? Again, so let's read the question. The nurse performs morning rounds in a medical surgical unit. Which client requires immediate attention? A. The 44-year-old client with duodenal ulcer who reports abdominal pain and hemoptysis. Letter B. The 60-year-old client with uremia who complains of dry, itchy skin and ammonia-like breath odor. Letter C. The 55-year-old client who develops severe chills, body aches, and fatigue due to flu infection. Or letter D. The 70-year-old client with hepatitis A who has jaundice, clay-colored stool, and dark yellow urine. Okay? Use the process of elimination, everyone. And can you please give me a rationale for your answer? Read the question carefully. Okay? And you have to remember, everybody, that in the NCLEX, your management of care in the test plan is 17 to 23%. 17 to 23% management of care. And under your management of care will be the prioritization and delegation questions. So you have to imagine that if you have a 100-item question, 23 of those could be coming from management of care. Okay? So read the question and what's your rationale? Maureen, May, Manu, okay, Cherise, Iwad. What's your rationale for the question, everyone? Okay, so let's pick the answer. So what is your strategy in answering this question? Again, I reminded you, okay, before that to answer questions like this, number one, the first step is always to find out if that patient is stable or unstable. Okay, but before you can say unstable or unstable, you have to think, are the symptoms acute or chronic? Okay, are they acute or chronic? Or are the symptoms expected or unexpected? And then you decide if it's stable or unstable. And of course, you have to look at the clinical situation as well. You have to look for words that indicate the patient is unstable. So let's have the answer to this question, guys. Okay. The answer to the question is going to be letter. Of course, it's letter A, everyone. Okay. Letter A. Now, why is letter A the answer? Well, because number one, it's a client with duodenal ulcer, and we all know that there's abdominal pain. However, the fact that the patient is having hemoptysis is spitting blood. Vomiting blood is hematemesis. Now, someone with ulcer having blood, expectorating blood, is not expected. That could indicate what? Perforation of an ulcer. Perforation. So you don't expect hemoptysis in someone with duodenal ulcer because that means that there's a complication. Okay, patient could be vomiting blood. That's why letter A is the answer. Okay, now your letter B. Your letter B, the 60-year-old client with uremia. Now, everybody, what is uremia? Can you please type that on the chat box or comment? What is uremia first? Uremia means end-stage renal disease, someone with renal failure, okay, or chronic kidney injury. So those with chronic kidney injury, it is somehow expected that they will have dry, itchy skin, okay, the skin precipitate, okay. um, then you also have your ammonia-like breath odor, your fetor hepaticus. So you go back to the signs and symptoms of chronic kidney disease or chronic renal failure, and you will realize that letter B is somehow expected from these patients, okay. Dry itchy skin and ammonia-like breath odor, unless the symptoms are getting worse, then maybe letter B is a priority, okay. Now, letter C, the 55-year-old client who develops severe chills, body aches, and fatigue due to flu infection. Well, if someone is having flu, then letter C is expected. Your body ache, your fatigue, your severe chills. Unless the person develops difficulty breathing, then that's a different story. Am I right? Difficulty of breathing, because that means that letter C, someone with flu is getting worse. Am I right? So letter C, kind of like expected. There's no difficulty of breathing or dyspnea in that question. Now, letter D, the 70-year-old client with hepatitis A who has jaundice, clay-colored stool, and dark yellow urine. Well, definitely that's expected from the condition as well. Okay? So, letter B, C, and D are expected findings in those situations. Unless you have clinical indications that the condition is getting worse. For example, the patient starts becoming drowsy, a change in the level of consciousness, or let's say the patient, for example, is developing shortness of breath. Something that is new and something that is unexpected, and you would say that those are priorities. Okay, so the answer is letter A, because we all know that hemoptysis is not a usual manifestation of your duodenal ulcer. Okay, so hopefully that helped you a little bit, guys. Okay, can someone tell me the correct terminology for the dry, itchy skin in patients with chronic renal disease? What do you call that? The skin precipitate. The crystallization, the waste products are excreted through the skin in patients with chronic renal disease. So what do you call that? What is the terminology? Can you tell me in the comment section? Okay, thank you, guys. Now let's go to the next question. All right, so we have a continuation. So let's have a discussion. Gastric ulcer. A client with gastric ulcers admitted in the medical surgical unit. Which behavior is best associated with a client's diagnosis? A. Refuses meals due to abdominal pain when eating. B. Requests for sandwich to relieve hunger at night. C. Complains of heartburn 2 hours after meals. Or D. Develops sweating after eating starchy foods. Okay. Again, a client with gastric ulcer is admitted in the medical surgical unit. Which behavior is best associated with the client's diagnosis? A. Refuses meals due to abdominal pain when eating. B. Requests for sandwich to relieve hunger at night. C. Complains of heartburn 2 hours after meals. Or D. Develops sweating after eating starchy foods. Can you also tell me from what state or international country are you all coming from? Would like to share that. Where's the students coming from in this class? Okay, are you from California, Long Beach, California, or Arizona, or Philippines, or Saudi Arabia, Nigeria? Where's your location, everyone? And can you please give a rationale for your answer, guys? Why you chose letter A, B, C, or D? Okay. UK. So UK is Charis Iwad. Signed in Conte, Wisconsin. We have Cheryl Antipolo, Philippines. Doreen Simpson is New Jersey. Chantal Floraville is Florida. Okay. Mommy Dolly, Philadelphia. Thank you guys for being here and for answering our Facebook Live. Celestine Bubot, Philippines. Josephine Auno is Philippines too. If you don't know, we have a self-study program available for Philippines and other students from other countries. Canada, Swabna Anish. Okay. Garima Srivastab, Nepal. Very good. Okay. Now, let's go to the answer to this question. Okay. Now, one of the things that I would like to remind you, everyone, is there's two types of peptic ulcer. Okay. Peptic ulcer is you have two types, your gastric and then your duodenal ulcer. Now, what are some of the causes of ulcer? Okay, peptic ulcer. Peptic ulcer develops because of, it could be due to stress, it could be due to H. pylori infection or Helicobacter pylori infection. Peptic ulcer could also develop because of brain injury or head injury, and you call the ulcer in brain injury as Cushing's ulcer. The ulcer found in patients with major burns is called your Curling's ulcer. Now, peptic ulcer could also be caused by medications like your steroids, aspirin, and NSAID medications as well. Okay, now there are differences between your gastric and then your duodenal ulcer. You have to remember that your gastric ulcer is the one that occurs, or the pain in gastric ulcer occurs when the patient is eating. In duodenal ulcer, the pain occurs when the stomach is empty. So that's the main difference. Very good, Garima, for putting the rational in the comment section. So the answer to this question, everyone, is going to be letter what? Letter A. Okay. Refuses meals due to abdominal pain when eating, because in gastric ulcer, the pain is occurs when the patient is eating. Okay. Your letter B, requesting for sandwich to relieve hunger at night. That would be for duodenal ulcer. Okay, because duodenal ulcer is relieved by food. And then letter C, complains of heartburn 2 hours after meals. That would be your duodenal ulcer, because duodenal ulcer occurs 2 to 3 hours after meals. The pain, 2 to 3 hours after meals. Your gastric ulcer, the pain will be 30 minutes to 1 hour after meals. Is with food. And then develop sweating after eating starchy foods. That is not related to the condition. Develop sweating after eating starchy foods could be found in which patients? Those with dumping syndrome. Dumping syndrome, what happens there is you have sweating, throbbing headache, you have nausea after eating starchy foods. But dumping syndrome is a different topic that I covered in another Facebook Live. Okay, so the answer for this is letter A. Now, weight loss is associated with a gastric ulcer, while weight gain is associated with patients who have duodenal ulcer because they tend to eat a lot. And duodenal ulcer, usually the pain occurs at night because the stomach is empty. And that's the reason why we give the medications to reduce acids throughout the night. Okay? So basically, those are the differences between your gastric and duodenal ulcer. And where is the pain whenever you have peptic ulcer? The pain will be in the epigastric area, so right here. Okay, so it could be a gnawing pain or burning pain. All right, so very good, guys. Now, what will be the main interventions for peptic ulcer? Of course, medications. Okay, medications. So let's proceed to the next question. All right, so another question. A client with a long history of gastric ulcer is brought to the emergency room due to signs and symptoms of shock after vomiting a large amount of blood. Which findings will be expected upon initial assessment of the client? Select all that apply. A. Tachycardia. B. Oliguria. C. Weakness. D. Hypertension. Or E. Tachypnea. So let's repeat. A client with a long history of gastric ulcer is brought to the emergency room due to signs and symptoms of shock after vomiting a large amount of blood. Which findings will be expected after initial assessment of the client? Select all that apply. A. Tachycardia. B. Oliguria. C. Weakness. D. Hypertension. Or E. Tachypnea. Again, a client with a long history of gastric ulcer is brought to the emergency room due to signs and symptoms of shock after vomiting a large amount of blood. Which findings will be expected upon initial assessment of the client? Select all that apply. A. Tachycardia. B. Oliguria. C. Weakness. D. Hypertension. Or E. Tachypnea. So this is a select all that apply question. All right. So you can put your answers there, everyone, and please put your rational. So be careful with this. When you answer select all that apply question, make sure that you, okay, that you answer you use the true or false approach, okay, when you're answering select all that apply question. So that will be true or false approach, okay. So this is a simple select all that apply question. With the next generation nursing later on, next generation Nclex format, you're going to have more choices in the select all that apply option. Okay, so let's have the answer to this question. So of course, for this question, you need to go back again and know the signs and symptoms of shock. Okay, very simple only. So the answer to this question, everyone, is going to be very good. So that will be your tachycardia, oliguria, weakness, and then you have your tachypnea. So that will be increased heart rate, decrease in the urine output, weakness, and then of course tachypnea. Very good. You don't have hypertension, everyone. So this is a quick review only. Okay. Now also other signs and symptoms of shock. Very good. Other signs and symptoms of shock will be initially in shock you will have hypertension, but then you're going to have hypotension or low blood pressure. You're going to also have definitely a decrease in the blood pressure, and then a narrowed pulse pressure. Then you can also have pallor. Cyanosis is never an early sign of oxygenation problem. Remember that. Cyanosis is never an early sign of oxygenation problem. Okay? So you have tachycardia, especially oliguria or decreased urine output is one of the best indicators of fluid deficit, especially uh, if you have vomiting of blood. Okay, congratulations for those who got the right answer, guys. Okay, so before anything else, I would like to plug in our program that's coming over in October. So we have the 10-day live comprehensive NCLEX review. You can join via classroom or webinar, so you have the choices. This is a blended learning course that combines live lectures and online assignments to master your nursing core content. So which means to say that major topics will be discussed, and there will be some topics that you can watch online. So there will be online assignments and quizzes as well. And then that will be October 15 to December 17, 2022, every Saturday from 9 to 4 p.m. Pacific time. And that will be in Cypress, California. So visit our website, and we'll also put the link in the comment section as well. So we have Garima Srivasta. More questions, please. I would love to. However, you can all watch our sessions. Do you know that tonight is the 70th session? Can you imagine that? So we have 1 to 70. So finish all of those, guys. Okay, 1 to 70 already. So you can find all of the videos in YouTube. Okay, and also in our Facebook page. Okay, so another one, just another information about our online NCLEX Academy. So if you decide for the self-study program, we have an interactive core content review and highly organized test plan-based curriculum. The number one highlight is the NCLEX Success Workbook. Okay, the NCLEX Success Workbook. And also we have our study plan checklist, hundreds of end of lessons NCLEX quizzes, and then you take your final NCLEX predictor assessment, Facebook live video recordings like this, and our Facebook discussion groups. Now, students, usually if you enroll in the program, I want to really meet you and I want to talk to you. So I meet the students virtually via Zoom. And then once you take your final assessment exam, I also encourage you to meet me again so we could discuss the results of your final assessment. Okay? Now, so this is the success workbook, everyone. Okay? Nclex Assess Workbook. Okay, and in the United States, when we send it out, then it comes in an Nclex box. Okay, this is not the last question, Sisaidin. We have another two questions. Okay, so two more questions. All right, so this is the next question, everyone. Okay, so the nurse administers ranitidine or Zantac to a client with peptic ulcer disease. This medication acts by what? What is the action of the medicine? So ranitidine or Zantac. So in the next few Facebook Live, we'll be probably focusing on pharmacology. Who likes to focus on pharmacology for our next Facebook Live? Can you click say yes in the chat box or in the comment section, guys? Who likes pharmacology for our next Facebook Live? Okay, so the nurse administers ranitidine or Zantac, which is a brand name, to a client with peptic ulcer disease. This medication acts by neutralizing gastric acid secretions, coating the ulcer to promote healing, C, suppressing the secretion of gastric acid, or D, inhibiting intestinal peristalsis. Now, what you have to remember, everyone, is that in the Nclex, there is no brand name. What you need to remember will be the generic name. Okay, I just put Zantac here, but in the future Facebook Live, I'm not going to put Zantac anymore. You have to memorize the generic names. Okay, so we have some people saying pharma. Okay, so I'll have some pharma questions. The next few Facebook Live is going to focus on pharma. Okay, all right. So this one is a very straightforward question, and you need to know the action of ranitidine or Zantac. And a lot of nurses are confused. You know what is ranitidine? So always remember that ranitidine is not an antacid. It is not an antacid. The answer to the question, guys, is going to be letter C, suppression of the secretion of gastric acid. So the action of ranitidine is to inhibit the production of hydrochloric acid. That's how it acts. It is not a medication that neutralizes gastric acid secretions. What medications neutralize gastric acid secretions? Those would be your antacids. Antacids that are composed of aluminum and magnesium, and we can discuss more about that later on. Letter B, coating the ulcer to promote healing. That is for your sucralfate. Just a review of your antacids first, everyone. Just remember that antacids may be composed of aluminum and magnesium. What is the side effect of antacids containing aluminum? That would be constipation. Antacids containing magnesium, the side effect will be diarrhea. Okay, and aluminum hydroxide, which is an antacid, is also a medication being used to lower down the level of phosphorus, especially in patients with renal failure. Okay, now letter C is the answer to this question. Now remember that your ranitidine or Zantac is an H2 blocker or histamine antagonist, so it suppresses the secretion of gastric acid. It is somehow similar to your PPI or proton pump inhibitors, that they also suppress the secretion of gastric acid. So don't be confused. Your antacids are the ones that neutralizes gastric acid secretions, while your ranitidine, your H2 blocker, suppresses the secretion of gastric acid. Can you please put in the comment section, okay, when do we give antacids, everyone? When is the best time to give antacids? Before meals or after meals? The Nclex will be asking you that. Antacids, when do you give them, guys? Antacids are given usually after what? After meals. Okay. Now, other examples of H2 blockers aside from ranitidine will be your cimetidine, your nizatidine also. And hopefully I'm pronouncing them correctly. Okay. All right. So antacids are not given before meals. Antacids are being given after meals. Okay. All right. So know your drugs for the GI, especially the differences in actions of medications. Okay. All right. I do have another question for all of you. The answer starts with letter M. Okay. The answer starts with letter M. Do you know the answer to this? What drug is given to prevent ulcer in patients taking high doses of Nsaids? Again, the answer to this question starts with letter M. Okay? So, what drug is given to prevent ulcers in patients taking high doses of Nsaids? So, what is that? The medication, everyone, is what? Letter M. So that would be your misoprostol. Okay. Metoclopramide Reglan is for nausea and vomiting. That's not the answer though, but nice try. The answer is misoprostol. Okay. Misoprostol is a medication that is given to prevent ulcers in those patients. The brand name for that is Cytotec. This medication is used to prevent stomach ulcers while taking NSAIDs such as aspirin, ibuprofen, or naproxen, especially if the client is at risk for developing ulcers. Okay, so remember that medication, misoprostol.
Misoprostol.
Okay, so the pronunciation is misoprostol.
Misoprostol.
Okay, let me repeat that.
Misoprostol.
Okay, so she said it. Misoprostol is not misoprostol. Okay, can I have another pronunciation that I want to research here? Okay, all right, another one.
Ranitidine HCl.
Okay, ranitidine. It's not.
Ranitidine HCl.
Okay, so it's not ranitidine, but ranitidine.
Ranitidine HCl.
Okay, so ranitidine is used to treat ulcers of the stomach and intestines. Okay, all right, so that's it. Now let's go to the next question. Are you ready for our last question for tonight? I'm sorry, it's our last question, guys. Okay. All right. Hi, dearly Gustilo. Okay. Yes, correct, Garima. You call that also your cytotec or misoprostol. It is actually a medication that causes abortion as well. Okay. All right, so let's proceed. Let's go to the last question, everyone. Are you excited for our delegation question? Delegation. So the registered nurse cares for a client who is admitted for complications related to duodenal ulcer. Which task can be delegated to the licensed practical nurse? Very good, Josephine Mary Ono. Very good. A. Obtain nutritional history. B. Monitor labs for serum albumin. C. Administer sucralfate by tube feeding. D. Instruct the client on diet order. Or E. Remind the client to stop smoking. Okay. Protonics. Protonics is a PPI, dearly. Okay. Proton pump inhibitor. So let's go to our delegation question. The registered nurse cares for a client who is admitted for complications related to duodenal ulcer. Which task can be delegated to the licensed practical nurse? Select all that apply. A. Obtain nutritional history. B. Monitor labs for serum albumin. C. Administer sucralfate by tube feeding. D. Instruct the client on diet order. Or E. Remind the client to stop smoking. Who among you here wants me to publish a Q&A for delegation and prioritization? To publish in the book all the questions, around 300 questions from the Facebook Live, to be published in a book and with all the rationale. Who wants that? Can you click yes if you want that, guys? All the questions that we have here in the Facebook Live, we'll put them in a book. Okay? A big yes if you want it, guys, so that you are not just watching, but you can read also everything that we had in the Facebook Live. Okay, we're putting all of them in the book. Okay, I'm so excited. So we'll release that. Okay. All the questions from the Facebook Live, because these are all original questions, everyone. These are not copied questions. Did you hear me? These are not copied questions. These are all original questions, the one that we have in the Facebook Live. Let it be affordable, please. Of course, Josephine is going to be affordable. Thank you for that comment. All right, so what's the answer to the question? I hate to go, everybody, but I need to go. Okay, I will give you the final answers. The answer is delegation. All right, so let's see if you get the right answer. That would be administer sacral fate by tube feeding, remind the client to stop smoking as well. So that would be letter C and letter E. I think most of you got that right. Always remember that RNs cannot delegate eat. What's the meaning of eat? Eat, including planning. Planning cannot be delegated to. No way. So what's the meaning of eat? The RN cannot delegate eat. What's the meaning of that? The RN cannot delegate evaluation, assessment, and any teaching. So A is wrong. It's not included because obtaining nutritional history is a thorough assessment. So it's a new admission. So definitely thorough assessment. That would be for the RN. Okay. Monitoring labs, that's an evaluation. So evaluation, critical thinking, that would be for RN as well. Your letter D, instruct the client on diet order. We said teaching. Teaching for the first time or comprehensive teaching, that would be for the RN. So the word instruct, educate, okay, that would be for the RN. Instruct or educate. Now, letter C is within the scope of practice of the LPN. Okay, administering sucralfate, which is an anti-ulcer medication by tube feeding, so that would be within the scope of practice. And letter E, when it comes to the Nclex, UWorld also said this. Okay, UWorld, the CNA or the UAP and the LPN can actually remind the patient simple stuff, like for example to stop smoking. Especially with the LPN can reinforce information or remind the patient. Okay, remind the patient. Okay, so that's it, guys. Thank you very much for tonight. Before we end, okay, so if you want to be recognized as a big fan of Matus Tribe, you can purchase our mask and also our products at you can just visit our website and click on the merchandise. Okay, we have motivational shirts there. And of course, for last week, we would like to congratulate Mary Ann Clemente, okay, for winning our free 90-day online access Nclex review. Okay, so congratulate Mary Ann Clemente first, please. We're going to post the links to our programs in the chat box or in the comment section. The same thing with the book that I have, everything that's in our program. So you'll get the full package and all of the things that you need for content on our program. So thank you very much, everyone. I hate to see you go. Make your comments in the comment section, any suggestions, and any special message that you may have, guys. Have a great weekend, everybody, and thank you very much.